Hello everyone. Today I am going to discuss about cardiac arrhythmia. What is cardiac arrhythmia? Cardiac arrhythmia is nothing but abnormal heartbeat that is too fast or too low or irregular heartbeats. Here is definition. Cardiac arrhythmia. Cardiac arrhythmia is a condition in which the heartbeat becomes irregular or abnormal in rhythm. Normally, the heart rate ranges from 60 to 100 beats per minute, that is BPM. It is caused by disturbed electrical signals in the heart. It can be ranged from harmless to life-threatening, depending on type and severity. There are two main types of arrhythmia based on abnormal heart rhythm: bradycardia and tachycardia. Brady means low. Heartbeats below 60 ppm. BPM, beats per minute. Tachycardia means high. Heartbeat above 100 beats per minute. Arrhythmia are the most common complications seen in acute myocardial infarction. Now let's see the etiology. Why cardiac arrhythmia causes? Cardiac arrhythmia causes due to the myocardial ischemia, injury, or irritation to the conduction system, coronary artery disease, electrolyte imbalance in the blood, such as sodium potassium disturbance, structural and muscular changes in the heart, injury due to the heart attack, healing process after heart surgery. Sometimes irregular heart rhythm may also occur in a normal healthy hearts. Now we will see the definition of etiology. Cardiac arrhythmia may occur due to the several underlying causes. First one, ischemia and injury. Myocardial ischemia, which means reduced blood supply to the heart muscle. Myocardial infarction is nothing but heart attack. Injury or irritation to the cardiac conduction system means that control electric signals can also lead to irregular heartbeats. Next, second one, coronary artery disease. Narrowing or blockage of coronary arteries reduce oxygen supply to the heart muscle. This leads to the abnormal rhythms. Next, electrolyte imbalance. Disturbance in serum electrolytes such as sodium and potassium. Hypokalemia means low potassium. Hyperkalemia means high potassium. Strongly affect the arrhythmias. Next, structural and muscular changes. Cardiomyopathy. What is cardiomyopathy? This means the heart muscle become abnormal, either too thick, too weak, or too stiff, making it harder for heart to pump blood properly. Scarring or remolding of the cardiac muscle. When the heart gets hurt, like high blood pressure or heart attack, it tried to heal. But instead of healing perfectly, it forms scar tissue or change shape. This makes the heart less flexible and less strong. Next, post-heart surgery healing process. Fifth one, other contributing factor, stress or cardiac arrhythmia. Next, signs and symptoms. Palpitation, feeling of rapid or irregular heartbeat, dizziness or light headache, chest pain, dyspnea, difficulty in breathing, SOB, shortness of breath, fatigue or weakness, swelling due to the heart failure in the chronic cases, reduced exercise tolerance, sudden cardiac death in severe arrhythmias. Risk factors such as hypertension, advancing age, aging process, obesity, alcohol consumption, smoking, coronary heart disease, acute myocardial infarction. Next, complication, atrial fibrillation, risk of stroke and thromboembolism. Next, ventricular fibrillation, risk of sudden cardiac death. Next, stroke due to clot formation in the atrial fibrillation. Let's see physiotherapy. What we can change in our daily life. Measure aerobic exercise as tolerated.
weight management, control hypertension, diabetic and cholesterol, avoid alcohol and smoking, stress reduction, try technique, example, breathing, exercise, yoga, meditation.
Let's understand the pathophysiology of cardiac arrhythmia in a simple way. First, acceleration of the sinus rate lead to abnormal sinus impulse formation. This can cause a prolonged pause which result in SA node dysfunction. SA node dysfunction further lead to arterial dysfunction. All of this change can finally cause cardiac arrhythmia. On the other hand, conditions like myocardial infarction and coronary spasm, hypertension may lead to aortic stenosis. These causes degeneration or damage of conduction system. As a result, there is ventricular dysfunction which also leads to cardiac arrhythmia. Now we will see each term of pathophysiology. First one, acceleration of sinus rate, increased automaticity of sinoatrial, that is SA node, cause tachycardia. Second one, abnormal sinus impulse formation. Irregular or ectopic impulses arise instead of normal sinus rhythm. Third one, prolonged pause, delay or interruption in pulse generation or conduction result in bradycardia or heart attack. Next is a node, sinoatrial node dysfunction. Degeneration or dysfunction of a SA node lead to sick sinus syndrome. Fifth one, atrial dysfunction, disturbance in atrial conduction may lead to atrial fibrillation. Sixth one, myocardial ischemia or coronary spasm. Reduced oxygen supply or coronary artery spasm interfere with impulse conduction, producing arrhythmia. Seventh one, hypertension and aortic stenosis. Pressure overload cause structural changes and predispose to arrhythmia. Eighth one, degeneration or damage of conduction system. Fibrosis, aging, or post-surgical injury to the conduction pathway may result in conduction block. Ninth one, ventricular dysfunction, damage to ventricular muscle or conduction fiber predisposes to ventricular tachycardia or fibrillation. Now, let's talk about pharmacological treatment of cardiac arrhythmia. Drugs used here are called antiarrhythmic drugs, and they are classified into four main classes. Class 1 sodium channel blocker, class 2 beta adrenergic blocker, class 3 potassium action, class 4 calcium channel blocker. Class 1A sodium channel blocker, quinidine procainamide, class 1B lidocaine, class 1C flecainide propafenone, class 2 beta adrenergic blocker, that is propanol esmolol, class 3 potassium action drug amiodarone, class 4 calcium channel blocker, that is verapamil. Next, uses and side effects. Class 1 Sodium channel blocker, local anesthetic. Quinidine, it used to maintain the sinus rhythm. Side effect dizziness, hypertension, GI effect, that is gastrointestinal effect. Class 2 Beta blocker, propanolol. It is used to treat sinus tachycardia. It is used to prevent cardiac arrhythmia. Side effect bronchospasm. Class 3 Amiodarone. It is used to treat irregular heartbeat. Side effect lung, liver, thyroid issues. Skin changes, slow heartbeat. Class 4 Verapamil. It is used to reduce blood pressure and treat chest pain and irregular heartbeat. Side effect dizziness, slow blood pressure, slow heartbeat. Thank you for watching my video.